So I would like to introduce our first speaker this morning, and that is Marc Pattinson. And Marc is the director of the consultancy group GSC, and he is also part of the Interreg Europe policy learning platform. This morning, Marc is going to provide some insights from the Interreg Europe health-related project portfolio. So Marc, I will hand over to you now, if you can share your presentation.
Good morning. Thank you for the kind words. Firstly, can you see my screen?
Yes.
Good. Well, that's a good start. So thanks, Kathleen, also for and your team for inviting the Interreg Europe policy platform learning team. Bit of a mouthful just after breakfast, but it's important you get a feeling of where I'm from today and what resources are available for the whole community. And I think in particular, some of the key words you use, Kathleen, in your summary of Sapphire are perfectly aligned with the ambitions of the Interreg Europe policy learning platform. In particular, obviously connecting with regions, connecting with smart specialization strategies, using clusters to implement the initiatives and opportunities that are part of the let's say results of your CSA. So this morning I've got a couple of slides, but I'd like you to think of this document that I will share with you today as a resource document, because there are lots of links, and I know the organisers will be sharing the presentation. So when you get the document, you'll see there are opportunities to go and collect some of the information, get more details, rather than me having to read everything on this particular slideshow with you. So as was said in the introduction, the Interreg Europe policy learning platform. Yes?
Sorry to interrupt you. Could you share your presentation in presentation format? At the minute, we're seeing your whole screen with the slides down the side.
That should be possible. I should press something. Slideshow. Has it worked yet?
That's it now. That's perfect.
Good. That's what you're there for, to keep presentators like me on track. Anyway, what do we do at Interreg Europe? You know it's a European-wide program. We have 4 thematic areas, and I'm the sort of senior expert on the research and innovation thematic objective. We've got about 65 projects that were funded following 4 calls. So the job at Interreg Europe is to facilitate learning and exchange, avoid reinventing the wheel, accelerate policy learning, but most importantly, accelerate policy implementation, because I think that's what we try and achieve. How do we do that? There is a good practice database, so when you click on the link here, you'll get access to hundreds of projects which you can search using different thematic terms such as personalized medicine, precision medicine, etc. You can find in-depth stories of particular aspects of interest in the innovation domain. Centers of competence is one example. That one's from Bulgaria. We produce policy briefs. Now, it sounds a very grand title, but it's a way of showcasing some of the experience from the Interreg Europe community with a policy dimension. So there's a sort of a review of academic information, best practice, policy from the European Commission if it's relevant, and in the innovation and research thematic, there's been a whole series of papers I think could be of interest. There are also shorter pieces on policy digests and innovation research. But for those who want to look into the other schemes of SME support, which is the TO3, you might also find something interesting there. For those who don't know about Interreg Europe projects, I've just got one slide, so it's a very short summary, but there are basically 2 phases. The first one, and overall the projects last between 3.5 to 4 years, so there is more time than most projects. But phase 1 is about learning, understanding the different partner ecosystems, the good practices, study visits, sharing policy initiatives. So you're in this connection learning phase, and for those who are familiar with Vanguard, as Kathleen said, you're at that early stage of getting a better understanding of what opportunities might exist. Phase 2 is structured around the development and implementation of an action plan, and in particular, taking some good practices, taking any practice if you think it's relevant for your region, and trying to implement what we call policy changes that can impact upon the funding regimes, whether it's regional funding, operational program, ERDF funding, or other opportunities, and then pursuing the regional connections and looking for shared opportunities for other funding programs, basically creating a sustainable partnership. And it doesn't have to be with everybody on every theme, but trying to create those bilateral, trilateral relationships that will then help you over the years to implement good policy and improve the impact of the spending that is co-funded by European or national or regional funding. So those are the two main stages. This will give you access to the projects that I decided had the strongest health medtech function. So in this left-hand column, you've got the acronyms, very interesting ones, but the most obvious one would be medtech for Europe. And if you click on there, it will take you to the detailed description for describing what's happening, which partners, and you can see that all but one come from the TO1 thematic, which is innovation, and the first one is for innovation with the support of SMEs. And all searched with health, you end up with those results. So those are the projects. I will showcase some of the activities to, let's say, shed some light on this particular problematic. So if we look at some of the key words in the projects, it fixes clearly in your minds what is happening in these projects. In particular, there's a couple of projects that have looked on the role of public procurement and how the health sector has been particularly innovative in both the platforms and the delivery of innovation procurement. So there are some interesting examples that I will share in good practices. The e-health platforms and the digitalization, the security of health data. I don't need to explain that to you. I think you're all familiar with those issues, but there are projects that have looked into those issues in some detail. The actual delivery of services through telemedicine and related capacities for personalized medicine solutions are also present. The fourth theme here, the public funding that can be enhanced for either cluster-like triple, quadruple helix organizations, but also to accelerate the take-up of technology and innovation that comes from funding platforms. As we know, that the research community gets funding, the industry domains get funding. How can they actually get co-funding and deliver joint impacts? And last but not least, there are some in that list of projects that are mostly looking at the personalized healthy aging initiatives. So again, using those words, you can search the database and get access to good practices. I'm not going to read these in detail, but it just gives you an idea of the information that you can find on the good practices. So two examples on public procurement. The first one from Spain in the iBuy project. So it's looking at how pre-commercial procurement in the health sector with quite a high technology dimension, because it's looking at surgical robots. The second one is more at the public policy and public procurement at a strategic level. So that was interesting from the view of the Galicia health sector, and a second one on pre-commercial development research, also from Galicia. Slide move. This one looks more at the data issues, in particular artificial intelligence. in the region of Emilia-Romagna in Italy, looking at how getting together the right experts, whether they're IT, social professionals, health, to analyze how big data can enable you to make the diagnostics and the personalized preventive health interventions much more targeted. So that was from József Riska, is the name of the good practice. Ithaca, looking at the telemedicine focus. Again, on the first one is integrated care. This is looking at the aging population issues in the Friuli Venezia Giulia Italian region. Second one, looking at the broader issues on the EU level healthcare sector and remote telemetry monitoring. So regional telemedicine services can be found in those two, in this project called Ithaca. MedTech for Europe, looking at networking regional specialized observatories was the example here. And this one is looking to explain how the connections at the regional innovation ecosystem can actually facilitate cooperation and support the smart specialization domains that are supported by these regions. Last one, a project a number of you will have heard of, the Brightlands Maastricht Health Campus. And the idea for the good practice here was to showcase how the Brightlands open innovation platform ecosystem operates and how the lessons can be used to create other leading platforms. And I'll come back to that shortly. Aging and e-health, Ithaca, the Basque Country e-health strategy, the strong digitalization. And for each of the good practices you find on the database, you'll see there are insights that can be maybe used to track and identify what would be particularly interesting for your region or for your organization. The last part of the Interreg Europe policy process I want to share with you is the notion of policy changes. Now, this is very, very important because Interreg Europe isn't just about talking, exchanging, learning and sharing. It's about securing impact and securing a change in policies. So Interreg Europe partners have to demonstrate what policy changes have taken place. So without going into the jargon of what Call 1 is, but Call 1 are the oldest projects, so there's more chance of finding policy changes. And I focused here on two examples, but from the database you can actually find information from four projects. But here, Hokari, one of the partners in this one, the Czech partner, thought that some of the good practices they'd seen in other regions were relevant, and they then presented them to the Ministry of Trade and Industry that manages the ERDF operational program, and they reallocated some 450,000 euros for delivering projects that previously hadn't existed in their program. The call was launched last year, and they had 29 projects were submitted. They also used the best practice learning process to improve their operational program evaluation methods for the projects submitted. So not only a policy change, but a financial change and cascade funding towards the project beneficiaries coming from research and businesses. Last example on the policy change in the French region Auvergne-Rhône-Alpes, part of the MedTech for Europe. In fact, they're the coordinators. They've made policy changes in their regional plan and have just launched a new call on the basis of those policy changes called the Research and Innovation Booster. We don't have the results yet, but it's clearly inspired by the Limburg Brightlands Health Campus and the message to the research community in the Auvergne-Rhône-Alpes region was, okay, we're funding your research activities. We want now more commercialization. So we want a partnership with the SMEs when you submit for our funding requests. So conclusions, reach out to the policy learning platform, use them. The services are free of charge. Two of the sort of flagship service portfolios that we're particularly proud of is the peer review, which is a sort of 2-day on-site or online, Covid oblige, so we don't always come and see you. Looking at a policy challenge, it can be a spending challenge, but we bring experts, 5 experts into your region. And we recently did one in the Région Sud, Provence-Alpes-Côte d'Azur, on health and artificial intelligence. And we had 5 experts, spent 2 days with the regional policymakers, with the clusters, with the universities, sharing their lessons. Very hands-on, engaging process. Matchmaking sessions, shorter, not 2 days, but half a day meeting with like-minded practitioners, the help desk, etc. And good news for all of you is that the new Interreg Europe program we launched early 2022. There'll probably be some info days in November, December this year. And I have some privileged access to some slides. As you see, they're not on my particular format, but you can see that the timing is that we expect some calls to be launched early in 2022. So funding, projects such as the ones you're interested in the Sapphire community, about the regional connections, about supporting SMEs, about supporting cooperation in the triple helix or quadruple helix. So that's new funding that will come on stream early next year with the info calls later this year. The main features, revolution, evolution, I think you're familiar with that phase, but again, pan-European, so it's not just cross-border, which makes it interesting for bringing the best people together, no matter where they are. Regional policymakers remain the core targets. The first phase of the projects still is strongly targeting capacity building at a European level. That's important, and a bit more flexibility, more pilot projects. The phrase learning by doing is clearly on the agenda, and more flexibility in terms of thematic priorities. So look forward to seeing you in the next year, if I'm still retained as a policy learning platform expert. So that's where I'm at.
Yeah, thanks a lot, Marc. It was really interesting. So as Marc is leaving early, if you have a question for him, don't hesitate to put it in the chat or raise your hand now.
I'll stay with you, Cynthia, till about 11:30. So
yeah, thanks. So we have a first question. Is the policy learning platform open for all regions, and how can they reach out or sign up for it?
That's an easy question. That was a nice soft one to get me in a good mood, obviously, Cynthia. The platform is open to all. There are a certain amount of information that you get without registering. If you want to get access to the more in-depth feedback and opportunities, then you have to register. But you don't need to be in an Interreg Europe project. It is somebody from South America could register, and we would listen to their requests if it was relevant. So it's free to use, free for services. Those who have Interreg Europe project experience will benefit most, but it's certainly no barriers for accessing and getting time with the experts. As I said, there's different levels of expertise and the amount of time we can share with you.
Yeah, thanks. So you had a nice picture with the health as a subtopic, but is personalized medicine a specific focus or?
No, I mean it's a sub-theme in some of the projects. As I said, for example, I took the database and simply typed in some keywords, and obviously health comes out more often than personalized health, but it does precision medicine as well. And it's, again, in the new program, it's up to individuals to justify the policy dimension. But I think for those of you who are working with some of the Sapphire partners in the S3 for personalised medicine partnership, then you have that connectivity that we've already facilitated meetings with the smart specialisation platforms. We had a good meeting in Rovaniemi in Finland in 2019. So there's strong synergies that are sought by the policymakers. You know, it's the same people, and it's up to you to justify the personalised medicine angle. Same way that others have said, healthy aging is the priority for us. So you can see that it's not a problem to put that dimension into your new projects or your existing partnership searches.
Yeah, and how do you organize the matchmaking, and how do regions find each other on this specific topic?
Okay, well, it's what we call an on-demand service. You submit the request to your, if you're in the innovation, then you send it to me or my colleagues. We then work on a short description with you. What is the key focus of your matchmaking request? And then we launch all the publicity. We've got over 20,000 registered users on the policy learning platform. So it's not a small community. When we organize peer reviews, we launch calls and we find experts, and we have to make hard choices because we have very credible people. If your choice of thematic for a matchmaking is so narrow, it takes a bit more time, but we can normally find them. But again, it's a demand-led. We listen to you, we work with you. Say our time is for free to deliver a good matchmaking event.
So if a region is interested to start a project, they have to take contact with you.
Yeah, I mean, let's take a concrete example. If you want to start preparing your partnership building, your concept thinking for next year's Interreg Europe calls, then you could perhaps put a peer review process in place, a matchmaking. There will be the official matchmaking events for building, but if you're clever, then you start before everyone else. And I know there are only clever people on this call, so I'm sure you'll be thinking of how to use this opportunity.
Certainly. So, and what are the links between Interreg Europe, the smart specializations, the digital innovation hubs, the clusters, the European partnerships? It's sometimes difficult to have to understand the different links between all these.
You saved the most complicated question till last. You have to connect the relevant people according to the objectives of different programs. So I think the links between the Interreg Europe policy community and the S3 partnership community is obvious. Clusters are the facilitators for projects. If I was here talking about clusters, I would have found more projects with cluster focus compared to health. For example, if we've been talking about S3, there are probably, I think, 18 projects in my Tier 1 family that deal with the S3 industrial modernization partnerships. So there the links are very obvious. It becomes more challenging when we work on the digital innovation hubs. I think digitalization was the sort of a latter thematic priority in the work that we've been doing. But we recently held a workshop, an online webinar with DG Connect called Innovation Ecosystems. And so we facilitate that building. And whether it's health in rural areas, thanks to digitalization, or the latest cybersecurity institute that Toulon wants to create because it works in the maritime and cybersecurity field. It's a different level, but some are very obvious and some are very easy links to create. Others, it requires a bit more thought to where the synergies lie. But as I said, if people want to look at the webinars that we've organized, we've certainly done them in digitalization with the EDIH hubs program. One day it may be published, taking its time, and others are more aligned with the core policy areas, which are S3, which are clusters, which are linked to thematic areas such as health, for example. Health and sport. I think crossing thematics is some area I'm particularly keen on exploring opportunities. and we've seen that, for example, in the work that I think some of you have done in Sapphire with the sports community.
Mhm.
We've done similar work in some of the agro-food and digitalization as well. So crossover,
Okay.
it's a good way to
Yeah.
synergies.
Thanks. And we have also another question in the chat. How to address the policy at the different levels, national versus local? It's the particularity, the difficulties in Europe. So.
Yeah, I think in some partnerships we do actually have just national organizations working together, ministries. Majority are sort of not member state, but we've got some good examples of how that works. I think when you're building a partnership, it's probably best to work with organizations that have a similar administrative remit, because I think exchange of good practices, funding mechanisms make more sense if you're a regional authority different from a member state. So I would suggest that partnership building is done with organizations with a similar scale and of competencies.
Well, thanks. Yeah, it was the question of the person who is raising her hand. So I don't know if the question is answered or not, or if the person has another question. Otherwise, we can close now. But
I think, as I said, I see in the chat my presentation would be available, and don't hesitate to reach out to the Interreg Europe community, and myself and my colleague Arnaud Morisson. We're more than happy to help you pursue the ambitions of Sapphire and the other associated projects in the IC per Med family.
Yeah, thanks. So thanks a lot.
Pleasure.
Bye.
Bye.
There is a more specific question, but maybe you can just
do it on the chat if you want.
Yeah, or on the chat is also, it's nice for me. Thanks a lot.